All right, so let's start chapter 5, which is awesome. I love chapter 5. Chapter 5 is bone, the skeletal system. So we're headed into our second official system. The skeletal system. So we covered the integumentary system, now the skeletal system. This is one of my favorites. Here's your slide. By the end of today, you should be able to. This is just an introduction. So we have about 206 bones in our body. And I say about because that may actually be slightly different from person to person. Some people have a couple of extra bones, some people have fewer. This also includes cartilages between bones. So usually where you have a joint, like think about your elbow, where there's bones that make up your elbow joint, there's cartilage there to protect those bones, kind of cushion the bones so they don't contact one another directly. Ligaments that connect bone to bone, and then connective tissues that surround bone and protect bones. We'll talk about those. There's some connective tissue layers or linings that surround bone and protect it and isolate it from everything around it. And the skeletal system the skeleton is divided into two major components. The axial skeleton, think about the portions of the skeleton that are along an axis, the central axis. So your skull, bones in the thoracic cavity like your ribs, and your vertebral column, all along that kind of midline axis. And they form this longitudinal axis of the body. The appendicular skeleton is all the bones that attach to the axial skeleton, the bones that make up your shoulder, which is your pectoral girdle. So think about bones like your shoulder blade and your collarbone. So your clavicle is your collarbone, or your scapula is your shoulder blade, and the pelvic girdle, which is basically your hip bones, and then everything that's attached to those girdles all the way to the tips of your fingers and your toes. That's the appendicular skeleton. And this figure is showing that. So here, the yellow is the axial skeleton. The blue here is some cartilage that is making up some cartilage that connects the ribs here to this bone called the sternum, and then the vertebral column. So all the yellow here is the axial skeleton. Everything else, so here's the shoulder girdle and the hip girdle. Everything, all of these, those two girdles, basically these kind of structures or bones that all work together to connect your limbs, your upper limb, right? So the bones here and your lower limb to the axial skeleton. So basically this axial skeleton is the central axis to which your arms and your legs attach. So the skeletal system, I think I went the wrong direction. No, I didn't. Let's see here. That looks similar. So that slide was a duplicate. I'm going to move on to the next one. Functions of the skeleton to support things like muscles, right? So you support organs internally. There's some muscles that we'll talk about that surround internal organs and help keep them in place and safe. Storage of minerals like calcium, we'll discuss that. Blood cell production, like red blood cells and white blood cells in your body, are produced from bone to protect. Some bone surrounds internal organs and keeps them safe. So think about what bones would surround an internal organ that needs to stay safe, like the heart or the lungs. So touch your chest, your thoracic cavity, those bones there, your ribs, surround your heart and lungs to keep them protected. And movement. Muscle attaches to bone by way of structures called tendons. And those tendons, when muscle contracts, pulls on bone. And the function basically depends on the properties of bone tissue. So we'll get into two different types of bone tissue and why there's some differences. So the skeletal system, this provides structural support for the body, like a framework for attachment of soft tissues and organs. Some of the bones in our body have some connective tissue connections that kind of anchor some organs in place or help create a cavity in which those organs reside. The body needs to maintain very tightly calcium and phosphate concentrations. In the bone, there is basically 99% or more of the calcium in your body is stored in bone. So if calcium in the blood is too low, your body will remove some of the calcium from bone to keep it in a normal concentration, a normal window. Calcium is the most abundant mineral in the body, and your body normally contains about 1 to 2 kilograms of calcium, and 1 kilogram is 2.2 pounds. So more than 4 pounds of your body is just calcium. Most of that is stored in bone. So you only have about 1 to 2% that is not actually just stored in bone. So maybe a couple of milligrams compared to how much you actually have. Skeletal system provides protection. So again, I mentioned earlier, your ribs protect your heart and your lungs. But what else? What other bones? Think about what other bones protect really important structures in your body, like the skull. What does the skull protect? The vertebrae. The vertebrae down your vertebral column. So if you touch your back, right in the middle where your vertebrae reside, you can kind of feel those bumps. Those bumps are part of your vertebrae. What runs down through the vertebral column? All right, the spinal cord, good. So, and then the pelvis, so your pelvic bones or your hip bones basically cradle from behind, so posteriorly, they cradle some lower digestive system organs, some reproductive organs, and even some urinary system organs. Really important for protection. The red bone marrow, there are spaces in bone that are filled with bone marrow. That bone marrow is a site of red blood cell, white blood cell, and platelet production. So in your blood, you've got 3 different types of cells: red blood cells, white blood cells, and platelets. All of them are formed, they're actually synthesized in red bone marrow and then sent out into circulation in the blood to be fully functional. And then movement. Again, muscles attached to bone by way of ligaments. And ligaments are very similar to tendons. There's just a different type of connection. So tendons connect bone to muscle. Ligaments connect bone to bone. So ligaments are actually a part of the skeletal system. Tendons are part of the muscular system because they actually attach muscle to bone. And bones function as levers. So think about a lever, like a pulley system or a lever system that you've used before. When your bones create a joint, like your elbow joint or your shoulder joint or knee or hip, you're creating a lever. And when you move those joints, muscles attach to the bones around those joints. And when the muscles contract, they pull on the bone and move that lever, right? All the way into your fingertips. So look at your fingers and how they move around. The intricate movement of your fingers is all boils down to muscle contracting and the tendons that attach muscle to bone pulling on that bone and moving the bone. I think that's super cool. We classify bones by shape, and they're classified into 4 different categories listed here. We're going to go through them individually and discuss examples of each shape, like a flat bone. Thin and almost a parallel surface. Most flat bones form the roof of the skull. So you've got bones that we'll talk about. There's one pointed to here with the red arrow. This bone is called the parietal bone. It's a flat bone of the skull. The sternum. So here in this figure right there is the sternum. These two looks like 2 separate bones, but it's really just one. It's two parts of the same bone. This is your sternum. It's your big breastbone that you can touch that right in the middle of your chest. Your ribs are considered flat bones, and your scapula, which is your shoulder blade. So this bone here, that kind of triangular bone that you see there, that's a flat bone. Those bones oftentimes protect underlying soft tissues. So remember, these flat bones of the skull protect the brain. The flat bones that are the sternum and the ribs protect the heart and the lungs. And there's a lot of structures, kind of different areas of these bones where skeletal muscle can attach. So we'll talk about what's called bone markings And these bone markings are points of attachment sometimes for ligaments or tendons, where a tendon would attach muscle to that bone. Long bones. There's an arrow pointed to a long bone here, but you have lots of long bones. So here's a long bone. This is your humerus bone. If you've ever been walking through a door or hit your elbow, so hit this part of your elbow right here off of a hard surface, and it hurts really, really bad. They call it your funny bone. You just hit your funny bone. Your funny bone is your humerus. Ha ha ha. So that long and slender bone is your humerus. Here's also two long bones in your forearm, the ulna and the radius. So this is the one that's lateral is the radius, and the bone that is medial is the ulna. Those are long bones. Your femur is a long bone. Where's your femur? In the thigh, right? It's the largest, heaviest bone in the entire body. So this bone that you can kind of see right here is the upper part, the proximal portion of the femur. Remember, proximal is related to proximal, and distal are related to points of attachment, right? So this is the proximal portion or proximal end of the femur. Your bones in your hand, so look at your palm. The bones of your hand are called metacarpal bones. The bones in your wrist are carpals. So the bones in your hand are metacarpals. And then your phalanges, your fingers, are made up of long bones as well. You have lots and lots and lots of long bones. So you have long bones in your arm, your forearm, your thigh, your lower leg, the palms of your hand, the soles of your feet, and your fingers and toes are made up of all long bones. Lots of long bones. Irregularly shaped bones are just that. They have a short, flat, either notched or ridged surface, like the vertebrae. So the vertebrae are an example of irregularly shaped bones. Bones of the pelvis. So this big hip bone here is an irregular bone. And lots of the skull bones. There's two skull bones that are around your eyes that are very irregularly shaped, and we will talk about those bones. So you should know how to classify a bone based on its shape and give specific examples of those bones that we're talking about here as you're preparing for the exam, which Chapter 5 is not on exam 1, but this week you have exam 1 due. So you have 5 days to complete exam 1. There is no quiz for Chapter 5, but you will be accountable for the material for Chapter 5 on exam 2, not exam 1, and that's explained in Canvas. Short bones are small and boxy. You have short bones in your wrist. They're called your carpal bones. So bend and extend, flex and extend your wrist, move it around, and kind of right where your lower arm, your forearm meets your hand is your wrist, right? So right here, the bones of the forearm, remember this is the radius and this is the ulna medially. These are your carpal bones. Those carpal bones make up the bones of your wrist. There's 8 of them. And remember, here on either side of these carpal bones is all long bones. There's another long bone. And down here in the lower leg, the tibia and the fibula are long bones as well. But down in the ankle, so what makes up your ankle are called the tarsal bones. Those tarsal bones are also short bones. Now, bone markings, this is what makes bone difficult, I think, are the bone markings. They're just characteristic external or internal features of bones that are related to a specific function, like there's elevations or projections. So take a look at anywhere on your body where you can feel like a bony projection, like you can feel some sticking out in your wrist, in your elbow. There's some kind of bony projections or elevations in a bone. The back of your head, there's a bump on the posterior side of your head. There's think about your jawbone that have like projections sticking out of them. Your ankle bones, so look at your ankle, those bumps on your ankle, those are elevations or projections from a bone that tendons and ligaments can attach to. So remember, tendons connect muscle to bone and ligaments connect bone to bone. So around any joint, you've got both tendons and ligaments that help stabilize and create that joint and allow that joint to move. So remember, tendons connect muscle to bone, and tendons attach on one end to muscle and on the other end to an elevation or a projection on a bone. So we're going to talk about some of these elevations and projections that tendons or ligaments specifically attach to. You'll be able to identify a lot of these elevations or projections. Depressions in a bone or grooves or tunnels through a bone are usually spaces for a blood vessel or a nerve to pass through. So bone is really dense and tightly packed. So for a blood vessel to get through a bone or a nerve to get through a bone, it has to have a passageway. So these passageways are like depressions, grooves, tunnels. We'll talk about specific examples of these as we go. So these specific surface features, we're going to go through a list of all the types of surface features. I'm going to call them bone markings. These bone markings, we'll talk about in general what these bone markings are, and then we'll get into some specific examples of these bone markings as we go. Like a head of a bone is on the proximal end, so towards the closer to the point of attachment to the rest of the body. Like this is the big femur, the biggest bone in the body. Right here is the head of the femur. The neck of the femur is just past that. You see this narrow point here, or narrow region? That's the neck. A lot of bones have a head and a neck. Like the humerus in your upper arm has a head and a neck. The femur has a head and a neck. It actually kind of looks like a head and a neck from a person. The diaphysis, or the shaft of a long bone, so this is a long bone, is this long center portion here. So this is the diaphysis of this bone. Again, this head, the head of the femur, is what fits into your hip socket so that you can move your hip, flex and extend and rotate, and adduct and abduct your hip. A process is any projection or bump on a bone. You have lots of different processes we will talk about, like a tubercle. So this is the humerus bone, the bone in your upper arm. So right here would be your shoulder, and down here would be your elbow, right? So there's the head of the humerus I mentioned you had. Right behind it is the neck, and attached to the neck is what's called a tubercle, and you have a greater tubercle and a lesser tubercle. These tubercles are points of attachments for muscles that move your shoulder in some way, move your upper arm. So either rotate it laterally or rotate it medially. So take your humerus, your upper arm, and rotate that externally. So rotate your upper arm away from the middle of your body, and then rotate your upper arm in towards your body medially, right? Lateral rotation is external, away from you. Medial rotation is internally towards you, right? So rotate that. There's muscles that attach from over here in your shoulder, the rest of your shoulder, to these points. And when those muscles contract, they move and rotate this humerus in either direction. So points of attachment for tendons that are attached to muscles. A tuberosity is a smaller version of a tubercle. So it's a small rough projection that takes up a pretty broad area. So on the humerus, you have a tuberosity right here. So this whole kind of broad, rough bump right there, this tuberosity is called the deltoid tuberosity. So I want you to take one of your hands and touch your shoulder. And I want you to lift your arm laterally. So you're going to abduct, take your arm away from your body. Remember, adduction, adduction is basically moving your arm towards your body. So when you abduct your arm and lift it, kind of like you would make a T with your upper arms. So make a T with your upper arms, but hold one hand on your shoulder. That muscle that you're moving is called the deltoid muscle. Where it attaches on your humerus is called the deltoid tuberosity. This is a tuberosity right here. The trochlea is a smooth, grooved articular process, and an articular process is where another bone attaches. So take a look here. This is the trochlea here, right here. So these 2 points. There's another third point here that's a different structure. It's called the capitulum. We'll talk about it later. So the trochlea is where your ulna in your lower arm articulates, and where two bones connect to one another, it's called an articulation. Basically, that's a joint. So the trochlea is one example of a point of articulation, so that as the muscles, like your bicep muscle up here in your upper arm, attaches to the ulna below and contracts, those two bones work together and help the elbow joint basically move the way it's allowed to. These two structures here are also called condyles. So this is a specific example of a condyle. It's called the trochlea. There's another condyle, and condyles are smooth but rounded articular processes where bones articulate. So the bone that would articulate here would be the radius, the head of the radius. And here in the trochlea, the head of the ulna articulates to create your elbow joint. A trochanter is a much larger version of a tubercle. So a really large, rough projection. You only have two trochanters in your body that we will ever talk about, and they're on the femur. So right here is a big, huge bony projection. That's the greater trochanter. What you can't see here behind where this pointer is the lesser trochanter, and those are on the proximal end of the femur. A facet is a flat articular surface. So we'll talk about facets when we get to the ribs and the vertebrae as well. So there's facets that are small and flat, and they're an articular surface. So remember, an articular surface is where two bones articulate, they connect, create a joint. That facet, think of facet as a face of a bone, or a little kind of small flat area of a bone where another bone will connect. A crest, like here, this is your hip. This is your hip area. So this is one of your large hip bones. This large crest here is called the iliac crest, because this bone is called the ilium. So this is your big hip bone. You can feel that in your own hip. So touch your own hip, that big bone there that you can kind of touch at the front of your hip, anterior portion there, that's the iliac crest. A line is a low ridge that's a little bit more delicate than a crest. So this line here is a point of attachment for some tendons. A spine is a pointed but narrow process. So right here, this is called the ischial spine. There's a little spine that pokes out back here. And a ramus is an extension of a bone that makes an angle. So a ramus means arm-like or bar-like structure. So this whole bar here is called a ramus. And they usually take an angle. So in your jaw, your lower jaw, you have a ramus. Right where at the back of your jaw that angles, you can kind of feel where your jaw takes a turn. So underneath kind of your neck area there, that angle there, that's a ramus as well. Canals or meatus are large passageways through bone. So you have, for example, there's a structure here. Can you see that opening there? That's called the optic canal. Think about that, the optic canal. You have a nerve that runs through that. Remember, nerves and blood vessels need to have a canal or a passageway to get through bone. So the optic canal is the passageway for the optic nerve. So the eyeball sits here. The optic nerve connects to the eyeball and then has fibers that run through the optic canal back to the brain, so that when you see something like the figures that you're looking at right now, and you can see the optic canal, your eyeball is receiving that information, your retina is, and the optic nerve is communicating that information back to your brain through that passageway. A meatus, you have an example that you can't really see on this figure, but there's a couple of meatus that we'll talk about. One is the external acoustic meatus or external auditory meatus. That's basically your ear hole. So if you stick your finger in your ear, you're sticking your finger in your external acoustic meatus. A sinus is a chamber in a bone that's usually filled with air. So you've got this bone here is your frontal bone. So this kind of yellowish colored bone is the frontal bone. The sinus in here is the cavity. It's called the frontal sinus. That sinus is an air-filled space. Usually sinuses help make bone a little bit lighter. Remember, it's really densely packed. So it's a little bit lighter than than it would be had that chamber been filled, and usually have mucous membranes that line these sinuses. If you've ever had a sinus headache, where do you get pressure? In a sinus headache, you usually get pressure up here, right? Down here under your eyes, there's sinuses there. Maybe up through here, you get some pressure. Look, all these pink areas are sinuses, just cavities inside bone. And when you get sick or if you have allergies, they get filled with lots of mucus and then puts pressure on that cavity and basically gives you a headache. A fissure is like somebody took a knife and just stabbed it through the bone. It's kind of this elongated gap. It doesn't really have a shape to it. But right here is an example of a fissure. There's a superior orbital fissure. So this is your orbit where your eye resides. Yeah, this is the orbit. So this fissure is called the superior orbital fissure. Right down here is the inferior orbital fissure. So you have two of them, two fissures at the back of your orbit. A sulcus and a fossa. These are kind of grooves or depressions in bone. A sulcus is a narrow groove, but it's pretty deep. And a fossa is just a shallow depression. So you'll have we have what's called the mandible. So this lower jawbone is called the mandible. There's a mandibular fossa, a little depression in the upper part of the skull here, where you have this part. If you have ever been to a dentist or ever heard of TMJ syndrome, it's called temporomandibular. You have a joint that allows your lower jaw, flipped ahead accidentally, your lower jaw to open and close. There's a fossa that your lower jaw sits in, and that fossa is right up underneath here behind these bones where the pointer is. So we'll talk about specific examples of these as we go. But first we're going to talk about the structure of a long bone, because you have tons of long bones in your body, and every long bone has an example of both types of bone tissue. There's two different types. So in a long bone, you have the ends of long bones. The ends of long bones are called epiphyses, and one is an epiphysis. So think epi is on top of. The epiphysis is the end or the top or bottom of each long bone. And a diaphysis, we've talked about before, is the shaft of the long bone. So this whole long center portion is the diaphysis. The articular cartilage, remember, an articulation is a joint. So where there is a joint, there's an epiphysis of the long bone typically, and this epiphysis is covered by what's called articular cartilage, which is part of the skeletal system. That cartilage is there to cushion the joint so that you don't have bone-on-bone contact. It covers the part of bones that articulate with others. And it's avascular. A is without. Vascular is blood vessels. So these cartilages do not have blood supply. They get their blood supply, they get their nutrients and oxygen, and can get rid of waste basically by diffusion from the bone, or the fluid that's in that joint. It's called synovial fluid. If you cross-section a long bone, so if you take a slice of this bone and turn it out towards you, you can see this inner portion here, this cavity. It's called the marrow cavity or the medullary cavity. That cavity is basically runs right down through the diaphysis of the long bone, and in there you can find red bone marrow typically, which is what is involved in red blood cell production. And there's some yellow bone marrow where you can find fat tissue. Usually if there's yellowy tissue, it's adipose tissue nearby, which is your energy reserve. So you can store energy in adipose tissue, which is fat tissue. In the epiphysis, you can find mostly what's called spongy bone. And spongy bone is nicknamed spongy bone because it looks like a sponge. It has a network of struts and plates that basically resembles, it almost looks like a spider web, really thick spider web or lattice work. And spongy bone is always covered with a thin layer of the other type of bone tissue called compact bone. So spongy bone you can find in the epiphyses of long bones, surrounded by a layer of compact bone, which is really thick and dense bone. The kind of bone we usually think of when we think of bone is compact bone. So these are two types of bone tissue, spongy bone and compact bone. The periosteum Think peri means around or to surround, and osteo is bone, right? So osteo, the root word means bone, and peri means to around or to surround. So the periosteum is connective tissue. It's a layer of connective tissue that wraps around compact bones. It basically isolates bone from the surrounding tissues to protect bone, but it also plays a role in bone growth and repair, we'll talk about later. There's lots of arteries and veins that basically make their way through the periosteum to get into bone and supply blood to bone. So here's a long bone. Here's the epiphysis, and that epiphysis is all those little kind of, you see how this looks kind of like a sponge? That's spongy bone, or it's also called cancellous bone. You'll see it maybe both ways in your textbook, cancellous or spongy bone. It's surrounded by a layer of this thicker yellow portion. Here's my cursor. The thicker yellow portion, this is compact bone. So this is all compact bone. If we now cross-section and head back down to the epiphysis, on the other end, there's still compact bone, and internally there's a bunch of spongy bone. And then this cavity in here is the marrow cavity or medullary cavity. The components of bone are really twofold. Collagen, think about where you've heard the word collagen before. Usually if there's like a commercial on television and you hear somebody talking about collagen and how it makes your skin kind of tight when you're younger, that's exactly what this is. This is the same fiber as protein, but it makes up about 1/3 of bone. Collagen fibers are really long and strong, but flexible. So if you think about bone, you don't really think of bone as being flexible, but it is in just a little bit. So take a look. Without calcium that we're going to talk about next, stored in bone, this is what would happen with bone. You could actually bend it and flex it. So all these fibers are just collagen fibers, and it's missing a lot of the calcium it needs. So about 1/3 of your bone is made up of collagen, these long, strong, but flexible protein fibers. And then calcium, stored as calcium phosphate, which is why phosphate is so important, because one of the ways the only way that calcium can be stored in bone is attached to a phosphate molecule. The rest of bone is basically made up of this calcified matrix, and it forms crystals that makes bone hard, inflexible, but brittle at the same time. So you need a perfect combination of collagen with calcified crystals stored throughout that collagen and around that collagen that makes bone really strong, just a tiny bit flexible, but really resistant to shattering. So you need both collagen and calcium stored as these kind of crystals to make bone, to give bone its strong but just ever so flexible properties. And bone cells that make up bone, you think of bone cells. So we've talked about the word osteo before. So osteo is bone. What does site mean to you? Site is a cell, right? So an osteocyte is a bone cell. It's the major bone cell. We'll also talk about osteoblasts and osteoclasts. So there's 3 types of bone cells, and they're all critical to keeping bone healthy. An osteocyte is a mature bone cell, and that mature bone cell maintains what's called the matrix of bone. And the matrix is basically every component of bone that makes bone what bone is. So the calcium stored as calcium phosphate crystals, and the collagen fibers, everything around the collagen is basically the matrix of bone. And bone cells, osteocytes, can secrete chemicals that dissolve that matrix. And by dissolving the matrix, basically you get rid of the bone, the components of bone, like calcium. You can free up calcium, send it into the blood, and the phosphate, so that new bone can be formed. And rebuilding that matrix basically stimulates the deposition of mineral crystals, so calcium phosphate. The matrix is formed in layers. They're concentric layers called lamellae. And as they form concentric layers, osteocytes, as osteocytes and bone cells form new bone, they form new bone in these layers called lamellae. And as they form these layers, osteocytes, these mature bone cells, get trapped between these layers in little chambers called lacuna. And basically, as an osteocyte gets trapped in a lacuna, its chamber that its house that it hangs out in, an osteocyte has these little extensions. So you can see here, this is an osteocyte. This is an osteocyte, and then the extensions here, those extensions from one osteocyte to another osteocyte. So you have two here, one osteocyte, two osteocytes, and they can communicate to one another through little teeny tiny canals called canaliculi. So remember, bone is really dense. So when an osteocyte gets trapped in bone, it has no way to communicate to another cell unless it extends its membrane through a canaliculi or canaliculus, this little tiny canal, to another osteocyte. And osteocytes play a major role in bone repair, but they can't divide. Osteoblasts produce new bone in a process called ossification. These osteoblasts synthesize and release new proteins, so collagen. Osteoblasts are responsible for producing collagen and other compounds of the matrix that make bone hard. Osteocytes can develop from osteoblasts that are surrounded by matrix. So here's what happens. Osteoblasts secrete this matrix, the fluid component of bone. It's called osteoid. That osteoid is basically immature but new bone. And then as an osteoblast secretes this matrix around itself, it actually traps itself in bone. And when it traps itself in bone, the chamber it traps itself in is a lacuna. Well, that osteoblast then changes to become an osteocyte. So an osteoblast can what's called differentiate. It can change, mature into an osteocyte once it gets trapped in new bone. I think that's so cool. Osteoclasts are a completely different cell. They're huge. They can have 50 or more nuclei. So take a look. Here's an osteoclast. It's a gigantic cell. They derive from stem cells that can either become an osteocyte or a white blood cell called a monocyte. And those monocytes, basically what causes them to become one cell or another is just signals, hormones and chemicals in the body. But basically these osteoclasts remove bone, break it down by secreting these acidic enzymes that dissolve the matrix, the fluid component of bone where calcium is stored and where collagen fibers are located. Osteoclasts secrete these enzymes that break down the collagen fibers, called proteolytic enzymes, and acids that break down the matrix around the collagen fibers and basically just break bone down. And in breaking bone down, you release calcium into your blood. It's called osteolysis. Bone is osteo and lysis is to break down. So you're breaking down bone. It's called osteolysis. In compact bone, if you took a slide, a microscope slide and looked at it, it would look just like this. This is one major functional unit of bone called an osteon or a Haversian system. It's the basic functional unit of mature compact bone. You do not there are not located in spongy bone any osteons. So you can only find this in compact bone. And they're in compact bone. So take these little dark structures here. Those are lacunae, where you can find osteocytes. Remember, there's lamellae. So look at the concentric circles of bone here. So it kind of looks like a tree if you slice it in half, if you were thinking that. These concentric circles are called lamellae. And between the lamellae gets trapped osteocytes in lacunae. So that dark spot, dark spot, dark spot, dark spot, those are chambers, lacunae, where osteocytes reside. It looks like on the figure here, this got shifted. That should be pointing here, and this one should be pointing here. But these are all osteocytes trapped in lacunae. These little tiny, they look like little projections, like a sunburst. Those are canaliculi, those little tiny canals that allow one osteocyte in one lacuna to communicate to another osteocyte in another lacuna. And then a central canal. And the central canal is basically in an osteon, an area where arteries and veins can get into or out of a bone to supply blood to or drain blood from it. So these concentric rings, this is all basically one osteon, one Haversian system. It's a major functional unit of compact bone. Calcium balance in the body is so, so, so important. So bone is your major storage depot. 98% or more of the calcium in your body is stored in bone. And if you need calcium, your body will break bone down to free it up and send it into the blood. If you have too much calcium, then you'll store more of it in bone and build bone. And rarely calcium concentrations fluctuate by 10% or more. So you maintain a calcium ion concentration in the blood within a 10% range. So it's really tightly regulated, and here's why. Basically, that regulation, that homeostatic regulation, is necessary so that the skeleton can remain healthy. So osteoclasts erode the matrix and release calcium. So when osteoclasts are breaking bone down, they're releasing calcium into the blood. And on the opposite end of that, when osteoblasts, remember osteoblasts, build bone, they use calcium and deposit it into make new bone or new matrix in bone, right? Which is basically new bone. So the skeleton is involved in regulating calcium and calcium in the blood. So this homeostatic regulation is really important because skeletal muscle, heart, cardiomyocytes, the heart muscle, most muscle in the body, all muscle in the body relies on calcium to contract, to do its job. Neurons and the nervous system relies on calcium to communicate. So again, calcium is incredibly important. So to regulate calcium, the skeleton can either break bone down or build bone. The intestinal system basically is what absorbs calcium and phosphate from your diet. So think about foods that are high in calcium. The only way to get calcium into your body is to eat it, like dairy products, some green leafy vegetables, some fish. There's some food that you can consume that's high in calcium and phosphate. So the only way to get calcium into your body is to eat it, and then it gets absorbed through the intestines into your blood. And then the kidneys, which you wouldn't really normally think of calcium regulation happening at the kidneys, but it does. So the job of your kidneys is to filter your blood, and calcium can be filtered out of the blood, and you can excrete it in the urine, or that can be inhibited. So varying levels of calcium and phosphate ions can be lost in the urine, and your body can either lose more of it by filtering more out of the blood, or lose less of it by filtering less. The other thing that kidneys can do is help synthesize a vitamin called vitamin D. And vitamin D is really important in absorbing calcium through the intestines. So if any of you take a calcium pill, if you've ever know somebody that takes a calcium pill, or if you ever look at it at the grocery store, the next time you're at the grocery store, take a look at the calcium supplements. Most of them also have vitamin D in that same supplemental pill, purposely because vitamin D helps calcium be absorbed through the intestines. So really important. You think of vitamin D, you get vitamin D from the sun, so your skin makes it, but the kidneys have an enzyme there that actually activates vitamin D. So you don't actually make it in the skin in its active form. It's inactive and it has to be activated. The kidneys have an enzyme that activates vitamin D, and then vitamin D helps calcium absorption in the intestine. So really important. And here's a figure that kind of summarizes that. How your body regulates calcium. So normal calcium levels in the plasma, calcium is absorbed through the intestines. You can either store it in bone or release it from bone. So here's osteoblasts building bone and storing calcium. Here's that giant osteoclast breaking bone down and releasing calcium. And you can also excrete calcium and phosphate in the urine, more or less of it. And you can change the rate at which that happens. Two types of bone, compact bone and spongy bone. I've mentioned these before. We're going to spend a little bit of time talking about them. Osteons, the functional unit of bone, basically run, if you think about a long bone that has compact bone that surrounds that marrow cavity, all along that long diaphysis of the long bone, you've got really, really long osteons that basically run parallel to the axis of the bone. And they're made up of concentric rings, like lamellae that we've talked about, surrounding a central canal. Again, we talked about that figure a few slides back. Spongy bone, the struts, kind of little tiny bony network, those little tiny struts are called trabeculae. And we'll talk about them. They basically just lighten up bone. So in the epiphyses, the ends of long bones, you'll find spongy bone. So the sponginess of that bone is basically these little tiny bony connections. Those little bony connections are called trabeculae. So here it is. So if you take a cross section of a long bone, so here's a long bone, they just kind of blew up this figure. Right here is a layer of spongy bone. Those little struts here are called trabeculae. And then here's compact bone. Right there's an osteon and an osteon and another osteon. And here's a cross section of an osteon. Look at it, runs along the parallel axis of the bone. So osteons in a cross section just look like these little circles. They actually are along these long tubular structures. And right down through here is a central canal that runs right down the middle of an osteon where blood vessels reside. Lots of important stuff on that figure. Bone growth is really important. So your bones, when you get, as you get older from childhood, you grow taller, but you also grow bigger, right? Wider. So appositional growth is basically the growth that occurs to increase the diameter of a long bone. It's called appositional growth. And that occurs at the outer surface of the bone, where the cells of the periosteum differentiate into osteoblasts. So right here, I flipped back a slide. Right there is a layer, that periosteal layer. It's called the periosteum. Remember, peri means to surround or surrounding or around bone, osteo. So this periosteum is connective tissue mostly, but there's cells there that help bone divide and grow, that can divide and grow. So cells of the periosteum differentiate, they mature into osteoblasts. And osteoblasts, remember, they lay down new bone, they build bone. So they add bone matrix to the outer surface, which can increase the size, the width of a bone. And then as osteoblasts get trapped, when they're secreting this new matrix, they get trapped between the lamellae, those concentric layers of bone, and they then mature further into osteocytes. So there's lots of stuff going on here. Osteoblasts and osteocytes are really fancy. Osteoblasts can become an osteocyte when they get trapped in the lacunae, the chambers they reside in. And then as bone is broken down, osteocytes can differentiate back to an osteoblast to make new bone. So you can kind of toggle back and forth between an osteoblast and an osteocyte, depending on whether it's trapped, it's building new bone, osteoblast, or it's trapped in a lacunae, osteocyte, and then released from a lacuna back to an osteoblast. Crazy, right? And collagen fibers that form tendons and ligaments and the joint capsules basically cement into the lamellae as perforating fibers. So part of the periosteum is basically like it interdigitates, it kind of winds itself through the layers of the bone with these fibers that kind of just anchor them in place. So here they are. This is the periosteum, this outermost layer. If you peel it away, right here's the cells, the inner layer of cells that can differentiate into osteoblasts and start to build new bone here on the outer surface of the bone. Well, right there, can you see these fibers that perforate into bone? These fibers are called perforating fibers that basically anchor the periosteum and any tendon or ligament that's attached to this bone in place. So right here there's a lamellae, this layer. There's a new lamellae. So as osteoblasts do their job in appositional growth, they build new matrix. And as they build new matrix, they do it in these concentric layers called lamellae. And then as osteoblasts that were just making new bone get trapped between the lamellae in their lacunae, they become an osteocyte. On the endosteal side, so innermost, endo is within or lining the inside, again is osteo is bone, so that there's an incomplete cellular layer in the marrow cavity, so that the center, what happened? There we go. In the center of the new bone, right? So here's a big would be a cross-section of the diaphysis of a long bone. So the endosteal side is the inner side, the periosteal side is outer side, around the bone, and here's an osteoclast. So basically the endosteal layer of bone is covered by trabecular bone or spongy bone. And that lines the central canal of one osteon. It also covers just the endosteal side of the whole bone. And basically osteoclasts and osteoblasts break bone down, and then osteoblasts will build new bone as that bone is broken down. And here's how it happens. It's called endochondral ossification. And remember, ossification is the formation of new bone. So we're going to take this whole figure and break it down into steps, the steps of endochondral ossification. And this is the way that new bone is formed, but also how bone during development. So think about a baby that's developing in the womb. Their bones don't just form out of nowhere. They actually use a cartilage framework to use that cartilage and replace it with bone. So here's where we're going to start. This is all what's called hyaline cartilage. And we've talked about hyaline cartilage when we talked about tissues. And up until this point, again, this is only the second organ system we've covered, other than the integumentary system, because we covered cells and tissues first, so that we can come back and talk about how all these tissues make up organs in organ systems. So one of the tissues we talked about was hyaline cartilage, back from exam 1. Hyaline cartilage is basically providing this whole kind of framework here. It's providing a framework, like the framework to your home is made up of like wood beams, right? And maybe a little bit of concrete. That framework for our bones before they're formed is hyaline cartilage. And that hyaline cartilage framework basically is used to produce bone and replace the cartilage with bone. So eventually this bone becomes a long bone. So endochondral ossification is the process that your body uses to form long bones, like the humerus, the femur, the tibia in your lower leg, the fibula in your lower leg, or the radius and the ulna in your forearm. It's the most common method of bone formation. And again, endochondral ossification just occurs by way of replacing hyaline cartilage with bone. And it begins with this cartilaginous model. So what happens is there's several steps. We're going to go step by step through this process. This cartilage model, basically chondrocytes, remember chondro is cartilage and cyte is cell. So the cells of hyaline cartilage, chondrocytes, near the center of the shaft, what will be the shaft, right? So this is the shaft here, or the diaphysis, what will be the diaphysis. Chondrocytes enlarge, so they start to increase in their size. And they increase in their size, but they don't have room to do that. So as they grow, they basically just die and disintegrate. They just get removed. And that leaves cavities within that cartilage. So there's little tiny circles here. Those are cavities in there that chondrocytes have left behind. Once that has happened, blood vessels start to grow near the outer part of the diaphysis, right? So blood vessels grow around the edge of the cartilage model, the hyaline cartilage, and the cells of the perichondrium, remember peri means around, chondro is cartilage, those cells that once created the perichondrium, the layer of connective tissue around the cartilage, convert, they differentiate to osteoblasts. Remember, what do osteoblasts do? They build bone. So now these chondrocytes, or excuse me, the cells of the perichondrium become osteoblasts and start to build bone and create this collar, a superficial layer of bone around what will become the diaphysis. As that continues, the blood vessels then penetrate from the outer surface here to the inner components of what will eventually be the diaphysis of this long bone. Remember, the diaphysis has a marrow cavity. So that's what we're starting to create here, this marrow cavity. So fibroblasts, think fiber, blasts. Blast means to synthesize or produce something, right, or increase something. So fibroblasts produce fibers. They differentiate, change, mature into osteoblasts as well. And those osteoblasts start to produce what's called an ossification center. Remember, ossification is the production of, or the building of new bone. So ossification really starts at this little bony collar here, and then the production of osteoblasts start to produce new matrix and create this ossification center. It's called the primary ossification center. And that bone formation there begins with the formation of spongy bone, and it starts to spread towards both ends. So you start to build new bone here, and then it spreads out, heading towards what will be the epiphyses. Growth continues with what's called remodeling. So basically this creates the marrow cavity, where this first arrow is pointed here. The marrow cavity, remember, is the opening down the shaft of, or diaphysis of, the long bone. So as remodeling occurs, and remodeling is just the process and the combination of both building and breaking bone down. So basically, as you break bone down in here, you create this cavity, and then you start to build bone and compact it together. So there's some spongy bone here in this marrow cavity that was once here. And remodeling basically takes breaking bone down and building it happening at the same time to produce and widen the bone and lengthen the bone, and then create this cavity by excavating some of that bone away. So you build the thickness here, excavate some of the bone away with osteoclasts, and then continue to do that, remodel as the bone gets taller, longer. And then once the primary ossification center is built and you've got a marrow cavity, that will continue to grow. And then further, there's some osteoblasts here in the epiphyses that create secondary ossification centers, where new bone will be laid down as spongy bone, and it'll stay as spongy bone. Down here in the diaphysis, there's a thin layer of spongy bone around the medullary cavity, or the marrow cavity, but mostly compact bone that creates the long diaphysis. In the epiphyses, you just have spongy bone. The epiphyses fill with spongy bone, and they leave a layer of cartilage here between the epiphysis and the diaphysis down here. And that layer of cartilage will be the framework for new bone to be laid down, so that you'll lay bone down, build bone here, and the bone gets a little bit taller. There's more cartilage that stays here and continues up. So as you build bone on this side, the cartilage pushes up this way, and the bones get taller and taller and taller. And you continue to make new cartilage here, hyaline cartilage, replace some of that hyaline cartilage with bone, and make the bone taller and taller and taller. And that's how you get taller until you reach whatever height you're at now as an adult. So that's endochondral ossification. You should know the steps of the endochondral ossification, and what cells are involved, and what types of bone are formed from endochondral ossification, so long bones mostly. Appositional growth is the widening of bones. And then intramembranous ossification is another type of bone formation, but other bones like the jawbone and the skull bones up here in your head, and then your patella, which is your kneecap, form in this manner. So most long bones, most bones in the body, including long bones, which makes up a good portion, develop in the womb by way of endochondral ossification, and then continue to grow longer as you get taller, also by way of endochondral ossification, replacing hyaline cartilage with new bone. Intramembranous ossification doesn't start from a cartilage framework. It starts by building bone between membranes. So stem cells in this membranous tissue, it's connective tissue actually, start to differentiate immediately into osteoblasts. And that occurs deep to the dermis in the fetus. And basically what results is membranous bones. So bones basically trapped in membranes, intramembranous ossification, right? So that's I'm going to flip back and forth to make sure I'm covering everything I want to cover. But basically it's a really simple process. stem cells in connective tissue differentiate, they mature into osteoblasts and start to form new bone. And basically what happens is that bone continues to form and remodel by using osteoblasts and osteoclasts into your skull bones, which are basically two thick layers of compact bone separated by a thin layer of spongy bone. As long bones are growing, what's created is what's called an epiphyseal plate. And an epiphyseal plate is your growth plate. So think about where growth plates are located. I'm going to flip around and try to find a figure, go back to the figure here. So this, fingers aren't doing what I want them to today. So this epiphyseal cartilage right here, that's your growth plate, where growth is occurring, right? So it's called the epiphyseal cartilage or epiphyseal plate. That plate is where long bones continue to grow. So, and they grow in response to sex hormones like estrogen, progesterone, testosterone, growth hormone, right? Growth hormone would make sense, and some thyroid hormones. Basically, osteoblasts can produce bone faster than chondrocytes at the epiphyseal cartilage. And that cartilage eventually thins out and disappears when you stop growing. So once you hit puberty, you just kind of shoot up and get taller and taller and taller, but eventually that stops, right? You shouldn't be growing unless you're a little bit younger, or sometimes men can even continue to grow into their 20s. But usually we stop by the time we're 30. So anybody that's 30 or older, you're done growing, right? And the stopping of the cessation of growth basically occurs because of some sex hormones and changes in growth hormone and thyroid hormones. But what happens is your epiphyseal cartilage thins out and it actually disappears. So as opposed to continuing to build that cartilage so that you can replace that cartilage with bone, that stops. And as opposed to the epiphyseal plate or cartilage, you basically close the growth plate, is what we call it, and it becomes an epiphyseal line that you can see on x-rays. That x-ray, well, I will kind of show you here a little bit later what some fractures look like. But basically we're going to move on to the repair of a fracture. Here is the process of repairing a fracture. We're going to go step by step, like we did step by step with endochondral ossification, and talk about how your bone repairs itself once you have broken it. So the first step is, okay, you break your bone. Ouch, it hurts, lots of bad pain, you may bleed a little bit. The repair of the fracture starts almost immediately by forming a really large blood clot. It's called a fracture hematoma, and that develops within a couple of hours to prevent blood loss. So we've got a broken bone here. This blood clot forms around the site of fracture. It's called a fracture hematoma. So that's the first step. You then go to the hospital, get an x-ray, all that fun stuff, hopefully. And what begins to the process of repair is basically occurring, and what forms first is a layer of spongy bone on one side of the fracture internally, and a layer of spongy bone on the other side of the fracture externally. But basically what happens is you form these two, what's called calluses, an internal callus and an external callus, that helps just stabilize the break so that you don't make it even worse, right? So basically the cartilage, there's hyaline cartilage laid down here, and then spongy bone replaces it to stabilize the outer edges, either edge of the break. So at this point, you're probably in a cast and allowing time to heal. And that time to heal is really important to create this internal and external callus so that your body can take this spongy bone externally and spongy bone internally, remodel the bone, so change, build it, break some of it down, build it, break some of it down. This remodeling occurs to make a brand new bone, a connection between the bones. The cartilage of the external callus is replaced by spongy bone, and the bone fragments in the dead bone are removed and replaced. And then over time, remodeling occurs. So now you may be able to put weight on it. So you may have been walking around in a cast for a while. Maybe you get the cast off and you start walking on it again, but you're going to therapy or physical therapy or something to help just be careful while you're putting weight on the new bone. And that basically stimulates the bone to remodel over time. And all the way up to a year, this can happen But more often than not, at around the year mark of bone remodeling from the point of fracture, the bones usually repair themselves so they're completely healthy and even sometimes stronger than they originally were. And here's some types of fractures. Gross, right? I get to gross you out as we finish up this lecture. Transverse fractures, right? Here's an example of a transverse fracture, where you basically just, there's some kind of trauma perpendicularly to the bone and it cracks right in half. So this bone is the ulna in your lower arm, right? There's the radius, the other lower arm, your forearm bone. Spiral fractures are basically a twisting fracture. So the bone twists, like right here on this bone should actually be way up here. So the bone is like twisted around on itself. A displaced fracture just means the bone isn't kind of connected anymore. It's completely displaced. So you may have that kind of sticking out of the skin there. Compression fractures are usually related to vertebrae. So here's a normal vertebrae. Look at how compressed that is. So think about compressing something between like a vise or something. That's a compression fracture. Those are usually exclusive to vertebrae. Green stick fractures are a partial fracture. So the bone hasn't fractured completely through. It's just like a kind of one part of the bone has been fractured. Comminuted fractures are possibly the worst. It's just like a complete shattering of the bone. So this is the femur, the upper in your thigh. So right there's the head of the femur, right? The neck of the femur. There's trochanters that we talked about. And then here's the diaphysis. So this has been completely shattered. Usually this part of the bone will be sticking out through skin. Pretty gross, right? There is an epiphyseal fracture. So there's the growth plate. So that thin kind of darker line is the epiphyseal plate or epiphyseal cartilage, your growth plate. And you can fracture that. I fractured that when I was a kid. I was roller skating and I fell onto my wrist and I broke my growth plate in my left wrist. Fun fact for you guys. The Potts fracture is a unique fracture. It's specific to the distal end. Here's my cursor. There it is. The very distal end of this would be your tibia, excuse me. So the outer, or excuse me, inner ankle bone has been broken off right there. Should be up here. So that's a Potts fracture. And the Coles fracture is unique to the very end of, actually at your wrist. So this distal end of the wrist is broken in this instance. So those are the different types of fractures. And that concludes the first part of chapter 5. We have, I think, 3 more parts to complete here. So I will see you soon.